Welcome back. I'm an emergency doctor actively working at the emergency department of my hospital. In this Doctor's Corner series, we'll dive into lesser-known approaches and hidden strategies to help the people with critical illnesses. You can subscribe if you want to learn the latest news and healthy solutions about your life. Today, let's talk about oily hair and specifically zinc. Oily hair can feel simple on the surface. Your hair gets greasy quickly, your scalp feels heavy, and sometimes the roots look flat even shortly after washing. But look deeper. Why does oil build up on the scalp? How does the scalp decide how much oil to produce? And why would a mineral like zinc have anything to do with hair that becomes greasy too fast? Start with the scalp. Your scalp is skin. It has hair follicles, sweat glands, immune cells, blood vessels, and oil-producing glands called sebaceous glands. These glands produce sebum, an oily substance that helps protect the skin barrier, reduce water loss, and keep the hair shaft from becoming too dry. So sebum is not the enemy. You need some oil. The issue begins when oil production, scalp microbes, inflammation, washing habits, hormones, or product buildup create an imbalance. Ask yourself this. Is your hair just oily, or is your scalp also itchy, flaky, red, tender, or coated with greasy scales? That question matters. If it is only oiliness, zinc may help in a modest way, especially if your diet is low in zinc. But if oiliness comes with dandruff or seborrheic dermatitis, zinc becomes much more relevant, especially in the form of zinc pyrithione shampoo where available. Why? Because oily scalp and dandruff often overlap. Dandruff and seborrheic dermatitis are linked with oil-rich areas of the body, especially the scalp, eyebrows, around the nose, behind the ears, and the chest. In these areas, a yeast called Malassezia can grow more actively because it uses lipids from sebum. Your immune system may react to byproducts from that yeast. Then you get itching, flaking, redness, and greasy scale. The scalp may look oily, but underneath that oil there can be inflammation and barrier irritation. This is where topical zinc can be useful. Zinc pyrithione has been used in anti-dandruff shampoos because it has antifungal and antibacterial activity. It can reduce Malassezia activity on the scalp, and by doing that, it may reduce flaking, itch, and greasy scale. Notice the wording here. It does not magically shut down every oil gland. It does not cure your scalp forever. But if your oily hair is partly driven by dandruff or seborrheic dermatitis, reducing that inflammatory, yeast-related cycle can make the scalp look and feel less greasy. Look at your pattern. If your hair becomes oily within one day and you also see white flakes, yellowish flakes, itching, or redness, think scalp condition, not just cosmetic oil. Do this. Check the hairline, behind the ears, the eyebrows, and the sides of the nose. Are there greasy flakes there too? If yes, the scalp oiliness may be part of a broader seborrheic pattern. Now let's talk about zinc as a nutrient. Zinc is an essential mineral. Your body uses it for immune function, wound healing, cell growth, protein production, DNA synthesis, and normal skin barrier activity. The skin is a fast-renewing organ, and the scalp is part of that system. If zinc intake is inadequate, skin healing and immune balance can suffer. Some people may notice more irritation, slower healing, brittle hair, or changes in skin quality. That does not mean every person with oily hair is zinc deficient. Most people with oily hair are not automatically deficient, but zinc status is part of the larger picture of scalp health. How could zinc influence oiliness? There are several possible mechanisms. Zinc may help regulate inflammation in the skin. It may support normal keratinocyte function, meaning the way skin cells mature and shed. It may also have an influence on sebaceous gland activity. Older clinical observations suggested that zinc supplementation might reduce skin surface sebum in some people, but the evidence is not strong enough to promise a dramatic result, so keep this honest. Topical zinc has better practical support for dandruff-related oily scalp than oral zinc has for plain oily hair. Pay attention to that distinction. If your scalp is oily because you are a teenager, because of androgen sensitivity, because of genetics, because you sweat a lot, or because you use heavy products, zinc alone may not change everything. If your scalp is oily because dandruff and inflammation are contributing, a zinc-based anti-dandruff approach can be much more useful. So how should you use it? Start with the scalp, not the hair ends. If you are using a zinc pyrithione shampoo, apply it directly to the scalp. Massage it into the roots with your fingertips, not your nails. Let it sit for a few minutes before rinsing. Why let it sit? Because medicated shampoos need contact time. If you apply and rinse immediately, you may wash it away before it has a chance to work on the scalp surface. Use it 2 to 3 times per week at first, unless the product label says otherwise or your clinician gives you a different plan. On other wash days, use a gentle shampoo. If your hair ends become dry, condition only the mid-lengths and ends. Do not rub heavy conditioner into the scalp if your main issue is oil at the roots. Ask yourself after 2 to 4 weeks, is there less itch? Are flakes smaller? Does the scalp feel less coated? Does the hair stay fresh a little longer? If yes, continue in a maintenance rhythm, maybe once or twice weekly. If nothing changes, do not keep adding more and more product. Reassess. Maybe you need a different active ingredient, such as ketoconazole, selenium sulfide, salicylic acid, or a prescription treatment. A dermatologist can help identify whether this is seborrheic dermatitis, psoriasis, eczema, folliculitis, contact dermatitis, or another scalp issue. Now let's correct a common mistake. Many people with oily hair try to scrub harder. They use harsh shampoos, hot water, and aggressive brushing. Then the scalp becomes irritated. Irritated skin can itch, flake, and feel even more uncomfortable. Do this instead. Use lukewarm water, massage gently, rinse thoroughly, and keep products off the scalp when they are meant for hair lengths. Look at styling creams, oils, leave-in conditioners, dry shampoos, pomades, and heat protectants. Are they touching your roots every day? That can make hair look oily even when sebum production has not changed. Also, do not overuse dry shampoo. It can be helpful once in a while, but if it builds up, it can trap oil, sweat, and debris on the scalp. If you depend on it daily, ask why. Are you avoiding washing because you were told washing often is always bad? For an oily scalp, washing more often may be appropriate. Some people need daily washing. That is not a failure. It is scalp care matched to your biology. Now, what about oral zinc supplements? Start with food first when possible. Zinc is found in oysters, beef, poultry, seafood, beans, lentils, chickpeas, pumpkin seeds, nuts, dairy foods, eggs, and fortified grains. Animal sources are generally absorbed well. Plant sources can still be helpful, but phytates in some grains and legumes can reduce absorption. Soaking, sprouting, fermenting, and eating a varied diet can improve mineral availability. If you are considering a supplement, be careful with dose. Adults generally need small amounts each day, around 8 milligrams for many women and 11 milligrams for many men. Pregnancy and breastfeeding change needs, so ask a clinician before supplementing. The upper daily limit for adults is 40 milligrams from food and supplements combined, unless a clinician is treating a specific condition. More is not better. Too much zinc can cause nausea, vomiting, stomach pain, diarrhea, headache, and over time it can lower copper levels, affect blood counts, and interfere with immune function. Look at medication interactions. Zinc can reduce absorption of some antibiotics, especially tetracyclines and quinolones if taken too close together. It can also interact with penicillamine, a medication used for certain conditions. If you take prescription medicines, have kidney disease, liver disease, inflammatory bowel disease, a history of bariatric surgery, or a condition affecting absorption, talk with your doctor before starting zinc. If you are pregnant, trying to become pregnant, breastfeeding, or giving zinc to a child, get professional guidance. How would you know if low zinc is part of your problem? Ask yourself, is your diet restricted? Do you avoid meat and seafood without planning zinc sources? Do you have chronic diarrhea, inflammatory bowel disease, heavy alcohol use, poor appetite, or a history of weight loss surgery? Do you have slow wound healing or frequent infections? These do not prove zinc deficiency, but they make it more reasonable to discuss testing or supplementation with a clinician. Blood zinc testing can be difficult to interpret because levels shift with inflammation, meals, time of day, and illness. So do not self-diagnose based on one symptom. Now let's build a practical plan for oily hair using zinc intelligently. First, identify the type of oily scalp. Look for flakes, itching, redness, burning, or greasy scale. If these are present, choose a medicated anti-dandruff shampoo with zinc pyrithione where available, or discuss alternatives with a pharmacist or dermatologist. Use it correctly, with contact time. Second, simplify your routine. Stop applying oils to the scalp for a few weeks. Avoid heavy leave-in products at the roots. Rinse shampoo thoroughly. Clean your brush. Wash hats, pillowcases, headbands, and anything that touches the scalp. Why? Because oil and product residue can recycle back onto clean hair. Third, balance cleansing with barrier care. If your scalp is very oily but your hair ends are dry, treat them differently. Shampoo the scalp. Condition the ends. Do not punish the whole hair shaft for what the scalp is doing. Fourth, support zinc intake through food. Add a zinc-containing food most days. If you use plant-based foods, rotate legumes, seeds, nuts, and fortified foods. If you eat animal foods, seafood, poultry, eggs, and dairy can help. Keep the diet steady rather than chasing high-dose pills. Fifth, track response. Do not judge after one wash. Give a structured plan a few weeks. Take a simple note: wash day, product used, itch level, flakes, and how fast oil returns. Patterns teach you more than guessing. Now, when should you seek medical evaluation? Get checked if you have painful bumps, pus, spreading redness, fever, swollen lymph nodes, open sores, bleeding, thick crusting, patchy hair loss, sudden shedding, or severe itching that disrupts sleep. Also get evaluated if the scalp problem persists despite several weeks of proper over-the-counter care. If you have psoriasis elsewhere, eczema, immune suppression, diabetes, or you are on medications that affect the immune system, do not ignore a worsening scalp condition. Also, consider hormones. If oily hair appears along with new acne, irregular periods, increased facial hair growth, or scalp thinning, especially in women, ask about androgen-related conditions such as polycystic ovary syndrome. Zinc shampoo may help flakes, but it will not replace a proper hormonal evaluation. The key message is this: zinc can be helpful for oily hair when the oiliness is tied to scalp inflammation, dandruff, or seborrheic dermatitis. Topical zinc pyrithione works locally on the scalp surface and may reduce the yeast-related and inflammatory cycle that makes the scalp greasy, itchy, and flaky. Oral zinc supports normal skin and immune function, but it should be used thoughtfully, preferably through food first, and supplements should stay within safe limits unless your clinician advises otherwise. So start with observation. Look at your scalp. Ask why the oil is there. Choose the right form of zinc for the right reason. Use the shampoo correctly. Do not megadose supplements. And if your symptoms are severe, persistent, painful, or linked with hair loss or hormonal changes, get professional care. Your scalp is not just hair maintenance, it is skin health. Treat it with patience, structure, and respect. Thank you for spending this time with me in Doctor's Corner. Take care of yourself, take care of the people around you, and I'll see you in the next topic.